Every year, the U.S. healthcare system bleeds $1.2 trillion in preventable spending. A massive chunk of that loss happens when vulnerable Medicaid members simply vanish from the support networks designed to keep them healthy. This graph illustrates the activation cliff. When a user disengages, their health deteriorates until the system pays for an $1,800 ER visit or an $11,000 hospital stay. Institutions look at this drop-off and assign blame, coding the patient's silence as apathy or non-compliance. But that silence is not a lack of willpower. It is a highly specific data point indicating that the individual has structurally collapsed under the weight of the system itself. This glowing iceberg shows how standard interventions, relying on apps and paperwork, only interact with the visible Under severe cognitive load, the prefrontal cortex goes offline, triggering capacity collapse as the body enters survival mode. In that state, standard clinical help actually hurts. Asking them to navigate a portal, fill out intake forms, and schedule follow-ups applies even more cognitive load to a nervous system already stretched to its breaking point. The administrative friction built to verify who gets help actively accelerates the crash, demanding a level of executive function the user currently does not possess. Engagement cannot be coerced through better reminders. It is a neurological capacity issue, requiring an entirely new kind of infrastructure, one designed specifically to prevent the collapse from happening. This interface is Saint. It completely abandons the aesthetic of public assistance, offering a mobile experience that feels like an exclusive, cult-coded membership rather than a clinical tool. Notice the bioluminescent text on the dark background. This dark mode ritual eliminates clinical white space, intentionally shifting the user's psychology away from receiving charity and toward accessing high-level status. Compare these two chat responses. Instead of a standard bot offering a sugar-coated prompt, Saint's AI companion, Siani, delivers relational truth, removing the stigma. She uses polyvagal attunement, calibrating pitch and pacing to bypass hypervigilance and soothe the nervous system. By stripping away the friction of shame, Saint generates the high-trust, daily engagement that legacy healthcare apps have rarely achieved. This diagram reveals the dual reality architecture at play. The aspirational cultural layer on top creates the trust needed to passively generate data for the massive enterprise risk model running underneath. This timeline illustrates the silence window. By monitoring daily interactions, the system flags microsignals of destabilization, like linguistic drift or sudden avoidance, 2 to 4 weeks before a costly crisis event actually happens. Here you can see the neural network of the intelligence layer. Saint deploys over 25 distinct engines that don't just process what a user says, but analyze how they speak, measuring voice prosody, text syntax, and the exact duration of their silences. Look at the glowing shield on screen. All of this is accomplished with strict privacy barriers. Raw conversational data never leaves the user's phone, relying entirely on federated learning to compute the behavioral insights locally on the device. The result is an invisible, continuous human presence that extracts highly predictive enterprise intelligence, securing user safety without resorting to surveillance. This enterprise dashboard tracks that intelligence in real time. By restoring a person's sovereign motion, Saint actively prevents the systemic financial leakage that drains health plans. Watch this chaotic open loop of anxiety transform into a solid circle. The platform measures its success by its loop closure rate, tracking exactly when a user converts a stressful unknown into a verified, completed action. That verifiable stability powers a diversified financial engine. Health plans pay a predictable monthly base of $25 to $40 per member per month for software access. On top of that stable base, the company earns performance upside, value-based bonuses when hospitalizations are avoided, $4,000 placement fees for secured employment, and additional revenue from licensing de-identified data. The financial model guarantees that Saint only scales its revenue when it successfully intercepts and prevents a human being from collapsing under load. This map shows the go-to-market strategy. Saint establishes its beachhead in the most difficult environment first, high-risk cohorts managed by Medicaid managed care organizations. Proving motion restoration here creates a blueprint. From that core, the infrastructure scales outward to tackle adjacent systemic failures in workforce retention, justice reentry, and housing stability. Legacy systems operate like an ambulance waiting at the bottom of a cliff. Saint acts as an all-terrain co-pilot, riding alongside the individual and flagging the risk miles before they reach the edge. This character model reflects the ultimate outcome. Saint exists to shift vulnerable populations out from the label of reactive patients, building the capacity they need to become sovereign individuals. By stabilizing the nervous system before it crashes, Saint prevents the collapse that stalls out individual lives and drains institutional budgets. It is the first infrastructure designed to keep capacity high, costs low, and the path to mobility open.